It's time for Veterans Issues, the show that brings you information about veterans, military, and their family. Now here's your host, Ken Rollins.
Welcome to Veterans Issues. Ken Rollins here. Today's guest is someone I've been trying to get down here for a while. He's the new director of the Birmingham VA Medical Center, Mr. Thomas Smith, and with him is somebody that's no stranger to this area, Jeff Hester. I want to say Jeffrey Hester, but I can't say Jeffrey. I don't know how to say Jeffrey. I say Jeff Hester's here from Birmingham BVAMC. Yeah, that's close enough. Stay where you are. Come back. We got something you'll want to hear. Stay there. Get the pen. Well, welcome back into Veterans Issues. Ken Rollins here, and today's guest is the new director of the Birmingham VA Hospital, and all the people in this area, and they've probably never met him, so you're going to get to meet him today, and welcome to the show, Thomas Smith.
Ken, pleased to meet you and pleased to be here.
Good to have you here.
Thank you.
Over to my other side of you is somebody who's been on the show before, and he's been around here for 30-something years, I guess it is. He's born in St. Clair County in Anniston, Alabama. His name is Jeff Hester. Jeff?
Yeah, good to see
Public
you,
Affairs.
Ken. Great to be back. Yes,
You're
sir.
Director of Public Affairs over there. Is that,
yes, sir. That's correct.
Got demoted or promoted.
Whatever you want to call it, it sounds good.
Well, I've talked about here a lot of times. I started using the VA hospital in Birmingham in the 60s, and I've seen it change over those years. When did you go to work over there, Jeff?
I've been there since 1990, 23 years.
Okay.
Yeah.
Well, the 60s was a little bit before that, and it was a place that was not run the way it is now, and in the last few years, we've seen some people that have pride in their jobs and care about the veterans, and that's one thing that I'm sure Mr. Smith's going to continue on over there, because I have not heard, and I get to hear a lot of stuff. I have not heard any bad stuff from the hospital. I know it's got to be something there. There's got to be some dust on the blinds or something somewhere, but I'll hear all good stuff from over there. Yeah. And appreciate you coming down doing the show today. And we're going to talk about some things that I've been telling folks you're going to be on here. They're expecting you to be here. And what's your background? Where'd you come from to get this job?
Well, Ken, I actually came here from Texas. I've been out at the Central Texas Veterans Healthcare System for the last 7.5 years. I ended up being the director out there before I came out here. It started out as the assistant director, then the associate director, and moved up to the director for the last 4 years. I can tell you that it's a pleasure to be here at Birmingham. Before I was in Texas, I had a 22-year Army career. I'm very proud of that and proud to serve my country. But this is kind of like coming home for me, because before the Army, I was born and raised just down the road here in Phoenix City, Alabama. So
wow.
It's a pleasure to be back in Alabama, and I tell you, it's a great pleasure to be heading up at such a great organization as the Birmingham VA Medical Center. Because before I even came out here, I did a little checking around on this fine institution, and I was told you've got a great organization here, you've got great staff, and I have not been proven wrong since I've come here.
Well, the last time the director that was Rika Lewis-Payton was on our show, and Jeff was there, her cell phone went off during a break, and she was notified that they were the Vision 7 winner of something, that it was the best hospital in this, what do they call it, Vision 7?
Yeah, the Network 7, which is Alabama, Georgia, South Carolina. We've got 8 facilities in that 3-state area. And
during that break, she found out that her hospital had become that. She was so proud, and I've seen that, and I've seen. Of course, Jeff is, I think last year, the Vietnam Veterans gave him an award for, he's done great stuff, and we're not going to talk about him too much, but we're going to talk about you. But it is, it's not unusual to have somebody have a problem, and I say, get in touch with Jeff Hester. He'll help you.
Absolutely. I'll tell you what, Jeff is a great asset for the Birmingham VA, and he's a veteran's friend. Absolutely.
Yeah. What is that woman that's been there for years and years as a veterans advocate?
Geneva Robinson. She's one of my top employees. She's been there over 40 years.
Yeah, she was there in the 60s when I was over there.
She is, and she will baby our veterans. She's birthed many of them up to the age where they are now. So they go to Geneva for everything. She's a good lady.
We've given her awards, and she's spoiled a bunch of them over there. I'm going to go see Geneva. And that's a threat. I'll go see Geneva. But anyhow, we got that. You've got a lot of challenges now with the returning Iraq, Afghanistan veterans and the women veterans. I'll say this I remember a director down the line way before Lewis Payton said, we don't have to worry about the women veterans because after World War II, women are gone, they won't be in it. Somewhere he forgot about Dan Rather talking to all these women that were serving in Vietnam. And so now you've been inundated by the women, you had to several years ago ramp up to take care of women, and now you got more coming.
Yep, absolutely. We've got about 7% of our veteran population are women now, and that's expected in the next 10 years to grow to 15%. And I can tell you that women do have their own special health care needs, and we have been ramping up over the last several years. A lot of resources have been put against women's health care. We now have primary care providers who've actually been trained in taking care of women's special issues, in addition to bringing on the OBGYN type of doctors to take care of women's special needs. We have a women's clinic actually where not only can they enroll in a regular patient line care team, but they can also align in a patient line care team in a women's clinic. It's their choice, but they do get that specialized care in the women's health clinic. For anything like obstetrics or any special really critical needs or specialized needs, we send them out into the community for that. But that's at the veterans or the VA's expense.
That was one of the things that I had heard more was, you're treating them, but you didn't have that clinic just for them. When they got their own clinic, that really, a lot of them really appreciate that.
Absolutely.
Jeff, what would you say in the last, let's say 10 years, what's been the biggest change to that facility over there?
The biggest change has gone that the facility aesthetically is getting very nice. The facility is beautiful.
Yeah.
You know, we're in a 60-year-old building, and we've got a good infrastructure, but we've constantly updated that facility, and I think we've got the nicest facility in the city of Birmingham. The rooms are beautiful. We've got pretty much all single rooms, a few semi-private rooms. They all have their individual bathrooms. A decade ago, we had congregate baths and different people and 3 and 4 to a room. So to see that change and to see the rooms beautified to meet the patient and the family's needs has been a huge improvement. You know, along with the medical care, that goes without saying. The medical care is superb with our affiliation with the University of Alabama at Birmingham School of Medicine, so we're very proud of that too. So I think the veterans get the best care in the world there, and we're very proud of that. And like you said earlier, our VA is considered one of the best in the country, not only by those that go out and look at all the performance measures, but from truly our veterans rating us. They really do love us, and
that's the main thing.
That's what's important to us too, and that's what we try to strive for. So,
well, the one thing, and I don't want to, I said I don't do any gotchas on here, but I want to complain that in there where the piano is, you got to play your piano. But you won't let people like me get over there and sit behind it and pretend I'm playing it. So
well, we will do that if you set it up there. Now, that piano was donated by our VFW as part of our patient-centered care, so they brought that piano.
Beautiful music.
And they'll sit down there and listen to it and take a nap.
But I'd like to go where they can't see me and just pretend that that's me and see all my buddies coming through, both of them.
Well, Ken, if you do that, I promise I'll come down and listen.
Just don't put a money bucket.
Don't put a tip jar up there, okay?
Yeah, don't do it. You scare me. We don't take donations around that way.
Yeah. Well, we're talking about the returning Iraq and Afghanistan veterans. We're going to be talking about a lot of PTSD problem, and we also got a different kind of veteran. And come back, and we're going to talk more about the unique veteran that you're going to be getting in the future. A lot of the amputees and things that the IEDs, but that PTSD is a big thing amongst these new ones. We got to take a pause here for a break, and then we'll come back. We're going to talk about the Affordable Care Act.
Yes, sir.
Anyhow, we're going to talk about Obamacare and VA. We'll come back. Stay where you are. I'll be right back. Get you a pen. Welcome back. When we're talking with the director of the VA hospital over in Birmingham, and Jeff Hester, the public affairs director. And when we left, I want to talk about something that some of your people have been here to talk about before, but suicide is a big deal in the military and veterans now that I've never seen in my years. We had 52 suicides in the military in the first 55 days of this year, and that's just unexcusable. We can't have it. There's some reason.
Yeah, it is, Ken, and that is one of the signature injuries of the wars in Afghanistan and Iraq, is these returning veterans who with these mental health issues, particularly PTSD, which can, along with depression, lead to suicide attempts. And I tell you, the VA has made an all-out effort to prevent that as well as to react to it. Jeff and I were talking on the way down here today about how at the Birmingham VA, we've grown from about 35 professionals in our mental health service to over 200. A lot of resources, again, have been put against the mental health issues for our returning war veterans.
Well, you can only do what you're funded to provide. I can remember back, I'll say the late 70s, when the VA was not even recognizing PTSD hardly. And Tuscaloosa was trying to start up a facility. I was the president of Vietnam Veterans of America, and I wrote a check for $1,000 to the clinic in Tuscaloosa, and they got that check framed down there. It's the first money they ever had. They didn't have any coming from the federal VA, and then it gained over the years, but not because of my effort, but there in Tuskegee, I supported both of them, gave a $1,000 check, but it is, and tape recorders and things like that, and the little TV monitors and stuff. PTSD has come awakening from the old time, what they call shell shock, back in World War II. And the Vietnam veterans, it was bad enough. Now you got these Iraqi and Afghanistan veterans. It's going to overload.
Absolutely. And I'll tell you, the Tuscaloosa VA is a great partner of ours. We have a lot of collaborative efforts with them. They do have inpatient acute psychiatry units over there, which we use on a regular basis, and then we support them in other specialty care areas. But getting back to the PTSD and the suicide prevention, the VA over the last several years has grown a great suicide prevention program. A lot of suicide prevention coordinators. They have a 24-hour hotline for folks that are having those kinds of thoughts. Those folks are out there working with our veterans on a daily basis. And every veteran who comes through our facilities, whether they're coming for an ear appointment or a primary care appointment, gets asked the questions about suicide prevention.
I had I have to be careful because it'll tell who these people are, but there's a young lady here in town that's PTSD as bad as anybody I ever seen. She's an Iraqi veteran. And what happened, what she experienced, rightfully so, is a traumatic experience.
Absolutely is.
I had a young lady here that came to the show. We had a Marine running across the United States. She came, I had her service dog, and the service dog was a PTSD alert dog. I had never heard of such, but her service dog was to alert her when she'd have a PTSD attack coming on, and that's something that's unique to me. So now this new day, we have to talk about women in everything that we're doing, not just the OBGYN and stuff,
That's absolutely true.
And, they're a big part of it. And now, homeless veterans, are y'all involved in that in any way that I'm not aware of?
We are. We in the last several years, again, a great homeless program has arisen within the VA. About 3 years ago, Secretary Shinseki, the VA secretary, announced that we were going to end homelessness among veterans within 5 years. And we're about 2 years away from that. I can tell you, there was something else we were talking about here on the way down. The Birmingham VA has eliminated 57% of the homelessness among veterans in our area. And has made great progress. There are a lot of homeless coordinators out there. We've partnered, the VA has partnered with the Housing and Urban Development to issue vouchers for housing for veterans. Those homeless coordinators go out there and find those homeless veterans. They get them health care, they try to get them employment, education, and training, and most importantly, they try to get a roof over their head and keep that roof over their head.
When they, on the State Board of Veterans Affairs, that subject come up a lot with me, and I'm going to have to say I did not. I wonder, how can a veteran be homeless, especially if they're drawing disability or something? How can they be homeless? And I thought, well, the ones I had met, some of them were by choice. But we did a study over a year with the Alabama Department of Veterans Affairs, and that study came back and proved something that proved me to be wrong and a lot of others. And so now, at the state level, we have a homeless veteran director we're having to allocate money for. I made that motion that we do that. That is something that I'd have never heard of, but we did it because the results of that feasibility study came back. And the bad part was, where did they live? And they lived in wooded areas mostly, and under bridges thing. That's where they live. And some of them, I had a woman that served on the State Board of Veterans Affairs with me that was a homeless veteran herself at one time, and Jeff knows who she is. And so you got a situation. They said, how could that be? There was one lady. She was conversing with her husband while he was overseas, or while she was overseas, in Afghanistan. And when she came back home, she goes to their apartment 2 days early to surprise him, and he didn't live there and had not lived there in 10 months. But her check was direct deposited in the bank. He took all the money and had been gone for 10 months, still conversing with her.
Oh.
And she thought she's coming home to their apartment, and she come home, she has no money in the bank. She's homeless, and there no relatives around. So there's certain situations where it's beyond their control, but we do have a problem with homeless veterans.
Well, if you've met one homeless veteran, you've met one homeless veteran. They each have their own issues. They have their own reasons for being homeless. And that's what these homeless coordinators do so well. Most of them are social workers, and they drill down and find out what is the issues that this particular veteran has, and then they address them with the resources we have.
PTSD people, a lot of them don't like to be around people. They don't like to be in corners hemmed up, and they don't like the social facility. They're antisocial to some extent, and they don't want to be in a situation like that. Now, one of the things is the parking deck over there, Jeff. The changed a year or so ago. Is that? I tell everybody every week that it's not going to change. Get used to it. Do you see anything that's going to change what I'm telling folks?
It is definitely changing, but now this is something that happened November the 1st. For those that know, we did not have a parking deck in Birmingham at the VA till 1994. We went into a 20-year lease with Children's. Children's expanded and built this big, beautiful facility. We, as good community partners, decided to lease that back to them and let them have it. Then we, in turn, went out and leased another parking deck from the Birmingham Parking Authority, which now we have 3, 2 for employees, 1 for patients. The one for patients is right down by the Birmingham News, and it's 600 spots. And we've worked on the elevators, getting benches. We've got new bathrooms in there, because this was not something we owned. It was something we leased from the Birmingham Parking Authority, but they've been great partners working with us to upgrade it to meet the needs of our veterans. And just this past week, now we've got 5 buses running that have air conditioner in them to make sure we get the patients back and forth in a timely manner, because at certain periods we've had veterans waiting an extended period of time, which 5 minutes to me is longer than they should wait. But they've been waiting, and many of these veterans are 70 and 80, 90 years old. We don't want them standing out there waiting. We want to get them in a shuttle, get them to their primary care, get them out and get them home and provide the best care that we can. So.
Normally about this time I would go into a break. We'd go to news you can use. We're still going to go to break, but I want y'all to stay over. I want to ask you real quick in 30 seconds. This Alabama open carry law has not changed. You still don't bring weapons into any of the VA facilities, am I correct?
That's correct.
Doesn't matter what the state law says, that's just a given.
It's important for our veterans to realize that all VA facilities are federal property. When you step off that sidewalk and into our facility, you're now on federal property. It's just like any Army or Navy installation. You are subject to the laws of the federal government, and those laws say you will not carry any weapons onto that facility.
All right, well, I want you to talk about Obamacare, so I'm going to skip the news you can use. We're going to go to a break and come back. We're going to stay with the director and the medical director and the public affairs. Stay where you are. Be right back. Welcome back to Veterans Issues. A little change this week. Not going to do the news you can use. I'll have that every week like I always do, but I want to cover some things that I brought the director down here. Main thing is this Affordable Care Act, or as we call it, Obamacare, in relation to your VA compensation. So, Mr. Smith, if someone is drawing disability they're in the VA health care, we all got this big letter, warned us about it or asking about it. Where do they stand with the Obamacare thing?
Well, as you know, the Affordable Care Act, which goes into effect this year, is meant to reduce the cost of health care and to provide high quality care for everyone across the board, across the nation. The thing that our veterans need to know is that it's pretty transparent for them. If they're enrolled in the VA for health care, they don't need to do anything. They just continue to go to the VA for their health care, and they don't have to enroll in any other plan or enroll in the VA. Everyone else is going to have to, as of October, go on a website, or contact through other means and designate what their health care plan is. So veterans need to know that if their family members are not covered by VA health care, then they're going to have to designate what the health care plan is for them. The best way to learn about what the Affordable Care Act is and what it means to our veterans is to go to a website, www.va.gov/ACA.
What is that?
It's www.va.gov/ACA, as in Affordable Care Act.
Well, I know we got a letter. I got one, and so did a lot of the guys and girls out here watching, and we kind of panicked because it came with a 2-page questionnaire, you know, and everybody saying, well, we're going to have to do this, going to lose this. And so I was answering. So I ended up calling the VA, and I got the same answer you got right there. But it was the Secretary of Kentucky spent a lot of time down in Jacksonville last week telling us the same thing you're talking about. But it is a big deal, and you said something. It's supposed to make our health care more affordable, and especially for our spouses. Now, TRICARE tell me about that, because we got a lot of people in this area that take TRICARE.
TRICARE will be the same. In fact, as a military retiree, me and my family are enrolled in TRICARE Prime, and it will be the same. Our enrollment in that particular health care plan will roll over into the Affordable Care Act, and it should be fairly transparent for us as well. Okay. And to my knowledge, there will not be any increase in premiums or co-pays or anything like that.
Well, I appreciate y'all being on the show. I've got a minute or so here, and I want to talk about appreciate you being on, Jeff.
Yes, sir. Good to see you again.
It was a pleasure meeting you,
if you
Ken.
hang around, I got to get this out there. The Veterans Court is being formed here in Calhoun County, and Judge Stedham is forming that court. If you'd like to be a mentor with that court, give me a call. My information's on the screen right here, and you can see it. Give me a call, and the parking is at the VA right now for the address. Still get the calls. Where is it? It's 2128 4th Avenue North, and we're still hiring down at the VA, down at the new Veterans Home in Pell City. The HMRveteranservices.com. This right here on your screen. Do that. Check on the career section. See what they got available. They are still hiring, so it's a good place to work. And I'll give the shout outs to Marquita, Dunkin' Donuts. People shut up about the Dunkin' Donuts, and IHOP, Erica, Michelle Shoshone, Miss Betty Carr, the ambassador to Anniston, and to Ashley Mitchell and Christine and Kim at Home Depot. A big shout out to Caitlin and to Bella. And this week's shout out salute goes to all those that provide health care for the veterans of the state of Alabama. See you next week here on Veterans Issues. So we're gone.